Part 10. Diagnosis and Treatment of Internal Medicine 2. Deviation of the eye and mouth. Distortion of the eyes and mouth, also called peripheral facial paralysis in modern medicine, is a sudden attack caused by invasions on the meridians and muscles in the facial region by pathogenic winds and cold. Its clinical manifestation is mainly facial muscle paralysis on the affected side. For treatment, needle puncture, gallbladder 20, Yifeng, Sanjiao 17, Jiache, stomach 6, Dicang, stomach 4, Yangbai, gallbladder 14, Sibai, stomach 2, and Taichung, liver 3 of the affected side. Points Hegu, large intestine 4 of both sides are needled with the even movement method, accompanied by moxibustion to disperse wind and regulate the meridians. After routine sterilization, puncture Fengshi, gallbladder 20, to eliminate wind. Puncture Yifeng, Sanjiao 17, to regulate the meridian. Puncture Yangbai, gallbladder 14, to regulate qi on the forehead area. Puncture Sibai, stomach 2, to regulate qi around the eye region. Puncture horizontally from Jiache, stomach 6, toward Dicang, stomach 4, and from Dicang, stomach 4, towards Jiache, stomach 6, to regulate qi in the facial region. Puncture Hegu, large intestine 4, a distal point. Puncture Taichung, liver 3, a distal point. Add Yinxiang, large intestine 20, with a flat nasolabial groove. Shui Go, Du 26, with an oblique philtrum. Add Chengjiang, Ren 24, with an oblique metalabial sulcus. The sparrow-pecking method is applied to points Yifeng, Sanjiao 17, Dicang, stomach 4, and Jiache, stomach 6, with moxibustion to regulate qi, blood, and the meridians. The treatment is given once a day or once every other day. One course consists of 12 treatments. B syndromes. B syndromes are characterized by obstruction of qi and blood in the meridians due to invasions of pathogenic wind, cold, and dampness, which are manifested by soreness and pain in the joints, numbness, heavy sensation in the limbs, and limitation of movement. B syndromes may be seen in rheumatic fever, arthritis, fibrositis, and neuralgia. Painful B. Painful B is characterized by severe pain in some joints or all the joints of the body with fixed localization. The pain is alleviated by warmth and aggravated by cold. The tongue coating is thin and white, and the pulse is tense. For treatment, needle points Shen Shu, bladder 23, Yao Yang Guan, do 3, Guan Yan Shu, bladder 26, Wei Zhong, bladder 40, Yang Ning Quan, gallbladder 34, with an even movement method, together with moxibustion to nourish the kidney young and dispel the pathogenic cold. Puncture Shen Shu, bladder 23, to strengthen the kidney qi. Puncture Yao Yang Guan, do 3, to strengthen the lumbus. Puncture Guan Yan Shu, bladder 26, to regulate and nourish the primary yang. Puncture Wei Zhong, bladder 40, to regulate qi in the lumbar region. And needle Yang Ning Quan, gallbladder 34, to relieve pain. Mild moxibustion is applied to Shen Shu, bladder 23, to warm and regulate the qi in blood. The treatment should be given once a day or every other day. One course is made up of 12 treatments. Wandering B. Wandering B is characterized by migrating pain in the joints, chills, and fever caused by pathogenic wind. There is a thin and sticky tongue coating, and the pulse is superficial and rolling. For treatment, the points Luiguan, Sanjiao 5, Yangchi, Sanjiao 4, Yangxi, large intestine 5, Qiaoshu, gallbladder 40, Kunlun, bladder 60, and Jiaohai, kidney 6, are needled with the twirling and reducing method to dispel the pathogenic wind. Add Xuehai, spleen 10, and Geshu, bladder 17, with an even movement method to invigorate blood circulation and dispel the wind. After routine sterilization, puncture Waiguan, Sanjiao 5 to disperse the wind. Puncture Yangzhi, Sanjiao 4 to dispel the pathogenic qi in the wrist region. And puncture Yangxi, large intestine 5 for the same purpose. Puncture Qiaoshu, gallbladder 40, Kunlun, bladder 60, Jiaohai, kidney 6, to expel the pathogenic qi in the ankle region. Puncture Geshu bladder 17 to invigorate blood circulation and dispel the wind. Puncture Xuehai spleen 10 for the same purpose. The treatment should be given once a day or every other day. One course is made up of 12 treatments. Fixed B. Fixed B is due to pathogenic dampness, which is characterized by numbness of muscles and painful joints. The pain is aggravated in cloudy and cold weather. There is a white and sticky tongue coating, and there is a soft pulse. For treatment, points Liangqiu, stomach 34, Dubi, stomach 35, Yinlingquan, spleen 9, Zusanli, stomach 36, and Shangqiu, spleen 5, are all needled with the even movement method together with moxibustion to nourish the spleen and stomach and eliminate the pathogenic dampness. After routine sterilization, puncture Liangqiu, stomach 34, to regulate the qi in the knee. Puncture Dubi, stomach 35, to promote the circulation of qi and blood in the knee. Puncture Zusanli, stomach 36, to nourish the stomach and eliminate dampness. Puncture Yinlingquan, spleen 9, to nourish the spleen. Puncture Shangqiu, spleen 5, to invigorate the functioning of the spleen and eliminate dampness. Use moxibustion in combination and apply an even and circulatory movement on points Zusanli, stomach 36, and Shangqiu, spleen 5 to strengthen the effect. The treatment should be given once a day or every other day. One course is made up of 12 treatments. Heat B. Heat B is due to the hyperactivity of the yang in the body. It is a result of the transformation of pathogenic factors into heat. Clinical manifestations are local redness, swelling and pain of the joints, and fever and thirst. There is a yellow tongue coating and a rolling and rapid pulse. For treatment, points Dazui, due 14, Quqi, large intestine 11, Liangqiu, stomach 34, Xuehai, spleen 10, Xiyan, extra point, and Yanglingquan, gallbladder 34, are needled with a reducing method to expel heat and regulate the meridian. After routine sterilization, spot prick on the point Dazui, due 14, to cause a little bleeding to expel the superficial heat of the yang. Quqi, large intestine 11, is needled in combination with the reducing method to expel wind and heat. Puncture Liangqiu, stomach 34, with the twirling and reducing method to expel heat in the knee region. Puncture 血海 spleen 10 to invigorate blood circulation and expel the wind. Puncture 细眼 extra point to disperse heat in the knee region. Yang Ling Quan, gallbladder 34, is needled with the reducing method to disperse heat and relax the muscles and tendons. The treatment is given once a day. A course is made up of 12 treatments. Frozen shoulder. Frozen shoulder commonly afflicts middle-aged or the elderly, so it is called the 50s shoulder. The ailment is due to cold invasion or strain. It refers to periarthritis of the shoulder in modern medicine. Frozen shoulder is characterized by pain in the shoulder joints and limitation of movement. For treatment, points Jianyu, large intestine 15, Jianliao, Sanjiao 14, and Miaoshu, small intestine 10, are needled with a lifting and thrusting method. Tiaokou, stomach 38, and Changshan, bladder 57, are punctured in combination with moxibustion to disperse wind, cold, and to warm and regulate the qi in blood. After routine sterilization, puncture Jianyu, large intestine 15, to expel wind and regulate the meridian. Puncture Jianliao, Sanjiao 14, to regulate the qi in the shoulder region. Puncture Miaoshu, small intestine 10, to expel wind and activate the function of the meridian. Puncture Tiaokou, stomach 38, towards Changshan, bladder 57, to relax the tendons. In combination, Jianyu, large intestine 15, and Jianliao, Sanjiao 14, are applied with moxibustion with an even and circulatory movement to warm the meridian and expel the cold. In the case of anterior shoulder pain, add Jianqian, extra point, to regulate qi in the front region of the shoulder. For forearm pain, add Bi Now, large intestine 14. And Qu, large intestine 11, to promote the circulation of qi in the forearm. For shoulder girdle pain, add Quyuan, small intestine 13, and Tianzong, small intestine 11, to disperse the pathogenic qi in that region. The treatment should be given once a day or once every other day. One course consists of 12 treatments. Sciatica. Sciatica is called Tui Gu Feng or Zuo Tun Feng in traditional Chinese medicine. Its main manifestation is mobile pain in the limbs down to the lower limbs. The ailment is generally caused by invasions of pathogenic wind, cold, and dampness which attack the meridians, or trauma in the lumbar region. Sciatica is characterized by pain along the distribution area of the sciatic nerve. Laysig's sign test shows positive. For treatment, Yang Si 14, Ya-Wu 15 of the Jiaji extra point, Hua Tiao gallbladder 30, Wei Zhong bladder 40, Yang Lingquan gallbladder 34, Xuan Zhong gallbladder 39, and Kunlun bladder 60 are needled with lifting and thrusting and the reducing method to eliminate the wind and cold and to invigorate the blood circulation and to relieve pain. After routine sterilization, puncture Yao Si 14. Yao 15 of Jiaji extra point to relax the lumbar muscles. Puncture Huan Tiao, gallbladder 30, until the sensation spreads to the foot, thus regulating the meridian and relieving the pain. Puncture Wei Zhong, bladder 40, to invigorate the blood circulation in the lumbus and knee. Puncture Yang Lingquan, gallbladder 34, to relax the tendons. Puncture Xuan Zhong, gallbladder 39, to nourish the marrow and strengthen the bones and tendons. Puncture Kunlun, bladder 60, to regulate qi in the foot region. The electric needle is applied to Huan Tiao, gallbladder 30, and Yang Lingquan, gallbladder 34, with a continuous wave and rapid frequency for 30 minutes to strengthen the effect. The treatment is given once a day. A course consists of 12 treatments. Lumbago. Lumbago, or lower back pain, refers to the pain in the lumbar region. It is mainly caused by the invasion of pathogenic cold and dampness or deficiency of kidney qi or by trauma. For treatment, points Shen Shu, gallbladder 23, Yao Yang Guan, Do 3, Guan Yuan Shu, bladder 26, and Wei Zhong, bladder 40, are needled with a reinforcing or even movement method to nourish the kidney and lumbus and invigorate the circulation of qi and blood. After routine sterilization, puncture Shen Shu, bladder 23, with a twirling and reinforcing method to nourish the kidney qi. Puncture Yao Yang Guan, Do 3, with a twirling and reinforcing method to strengthen the lumbus. Puncture Guan Yuan Shu, bladder 26, with an even movement method to regulate the qi in the lumbar region. Puncture Wei Zhong, bladder 40, a distal point, with an even movement method to relieve the lumbar pain. Apply moxibustion with a warming needle on Shen Shu, bladder 23, to achieve the effect of strengthening the kidney, warming the meridian, and dispelling the cold. After the needles are withdrawn, apply cupping treatment to the lumbar region to regulate the blood circulation. In case of lumbago due to cold and dampness, points Feng Fu, Do 16, Shu are added and treated with an even movement method to expel wind and cold. In the case of lumbago due to deficiency of kidney qi, needle Mingmen, Do 4, with the twirling and reinforcing method, and needle Zhishi, bladder 52, with the twirling and reinforcing method to strengthen the kidney. When it is due to deficiency of kidney yin, Taixi, kidney 3, is added and needled with a twirling and reinforcing method to nourish the kidney yin. muscle strain, Shui Go, Du 26, a distal point is added and needled. At the same time, the patient is encouraged to exercise his lumbus. Apply the spot pricking method with a 3-edge needle on Wei Zheng, bladder 40, to cause a little bleeding to expel stagnated blood. Hypochondriac pain. Hypochondriac pain occurs on one side or both sides of the hypochondriac regions. It is mainly caused by stagnation of the liver qi, by dampness and heat stasis inside the body, by traumatic injuries, or by the deficiency of the liver yin. Diseases of the liver, gallbladder, pleura, and intercostal nerves are included. 1. Excess syndrome. Hypochondriac pain due to stagnation of qi, dampness and heat, or trauma are excess syndromes. The patient with stagnation of qi has a thin and white tongue coating and a string-taut pulse. The patient with dampness and heat has a yellow and sticky tongue coating and has a string-taut and rolling pulse. The patient with traumatic injuries has a dark and purplish tongue and a deep and hesitant pulse. For treatment, points Zhigou, Sanjiao 6, Qimen, liver 14, Yangmingquan, gallbladder 34, and Taichung, liver 3, of the affected side are needled with a twirling and reducing method to remove the stagnation of liver qi and eliminate the dampness and heat. After routine sterilization, puncture Zhigou, Sanjiao 6 to remove obstruction in the Shaoyang meridian. Puncture horizontally Qimen, liver 14, along the intercostal space to pacify the liver. Puncture Yangmingquan, gallbladder 34, to regulate qi of the liver and the gallbladder. Puncture Taichung, liver 3, a distal point, for the same purpose. Qimen, liver 14, and Yangmingquan, gallbladder 34, are treated with the electric needle at high and low frequency for 30 minutes to strengthen the effect. The treatment is given once a day or once every other day. A course is made up of 12 treatments. 2. Deficiency syndrome. Deficiencies of essence and blood which cause poor nourishment of the liver and dull lingering pain of the hypochondriac region are of deficiency types. The diagnosis is a reddish tongue proper with little coating and a weak and rapid pulse. For treatment, Ganshu, bladder 18, Shenshu, bladder 23, Qimen, liver 14, Saninjiao, spleen 6, and Xingjian, liver 2, are needled with a twirling and reinforcing method to nourish essence and blood, invigorate the circulation of qi, and relieve pain. After routine sterilization, puncture Ganshu, bladder 18, to strengthen the liver yin. Shu, letter 23, to strengthen the kidney yin. Puncture Qi-men, liver 14, to nourish the liver yin. Puncture Sanin Jiao, spleen 6, to nourish the liver, spleen, and kidney. Puncture the yin point Xingjian, liver 2, with a twirling and reducing method to remove the false heat in the meridian. The treatment should be given once daily or once every other day. One course is made up of 12 treatments. Gastroptosis. Gastroptosis refers to the lowering of the stomach. It is mainly caused by the deficiency and weakness of the stomach and prolapse of qi, and is characterized by distension in the abdomen and emaciation. With reference to barium meal and X-ray examination, gastroptosis can be categorized into 3 degrees according to the length of gastric pits below the intertubercular line. The first degree is between 0.1 and 1.5 centimeters. The second is from 1.6 to 4.5 centimeters. The third is 4.6 centimeters or longer. The tongue proper is pale with a white coating and the pulse is deep and weak. For treatment, Zhongwan, Ren 12, Ti Wei, extra point, Wei Shang, extra point, Qi Hai, Ren 6, and Zhu Sanli, stomach 36, are needled with a twirling and reinforcing method to replenish vital energy and promote the function of the stomach. After routine sterilization, puncture Zhongwan, Ren 12, to strengthen qi of the stomach. Puncture Ti Wei, extra point, obliquely towards Qi Hai, Ren 6, and puncture Wei Shang, extra point, obliquely towards Qi Hai, Ren 6. Puncture Qi Hai, Ren 6, perpendicularly to nourish the essence of Qi. Puncture Zhu Sanli, stomach 36, to strengthen the spleen and stomach. electric needle can also be applied, with one end connected to Zhengwan, Ren 12, and the other dividing into 5 branches to connect both Qi-Wei, extra point, Wei-Shang, extra point, and Qi-Hai, Ren 6, respectively. Apply intermittent Wei for 30 minutes to the intensity of having contractions with the abdominal muscles and within the patient's endurance. The treatment is given once a day. One course consists of 12 treatments. Male sterility. Male sterility includes many diseases. Here only spermacrasia is discussed. Male sterility is mainly caused by a deficiency of kidney yin or yang, or by stasis of dampness and heat. The diagnosis is a pale tongue with a thin and white coating, and the pulse is deep and weak. The sperm count is below 6 by 10 to the 10th power per liter, meaning low ratio of fertilization. A sperm count below 2 by 10 to the 10th power per liter means difficulty in fertilization. For treatment, 2 groups of points are selected. The first group includes Shenshu, bladder 23, Zhishi, bladder 52, Ciliao, bladder 32, and Taixi, kidney 3. The second group includes Guanyuan, Ren 4, Dahe, kidney 12, Zusanli, stomach 36, and Sanyanjiao, spleen 6. The 2 groups are applied in turn with a twirling and reinforcing method to strengthen the kidney, spleen, and the reproductive essence. After routine sterilization, puncture Shenshu, bladder 23, to nourish the kidney. Puncture Zhishi, bladder 52, to strengthen the reproductive essence. Puncture Ciliao, bladder 32, to replenish the lower jaw. Puncture Taixi, kidney 3, to nourish the kidney essence. To strengthen the effect, mild moxibustion is applied to Shenshu, bladder 23, and Zhishi, bladder 52. Add Ganshu, bladder 18, for the liver and kidney deficiency types, and treat with the twirling and reinforcing method to strengthen liver yin. Add Zhongji, Ren 3, Quan, spleen 9, in stasis of dampness and heat type, and treat with a twirling and reinforcing method to expel dampness and heat.